Hello, this is Dr. Jawad. Please subscribe to my channel for more up-to-date videos, and thanks for watching. Hello everyone, this is Dr. Jawad. In this short video, I'm going to talk about a common condition that a lot of people have. They don't know about it because this condition can lead up to an autoimmune disease called celiac disease, okay? And it's called leaky gut syndrome. Now, what leaky gut syndrome is, it's otherwise known as intestinal permeability. So your gastrointestinal tract should be one big long tube from your mouth all the way to the stomach, from the stomach to the small intestine to the large intestines, all the way to the rectum. Now, due to the choice of foods, in the small intestines we have what's called tight junctions, okay? Now what the food does, the food that we don't agree upon, it actually unzips these tight junctions and food particles pass through the intestinal wall and they get into the bloodstream, which causes an immune response. So what happens, we get GI inflammation due to foods like gluten, soy, dairy, trans fats. What it does, it causes GI inflammation. It unzips the gap junctions, and the undigested food particles, toxins, and bacteria get through those gap junctions into the bloodstream. And once it gets into the bloodstream, it increases the immune response. And this is where we get sick. Now, 70 to 80% of our immune system is in our stomach and our small intestines through what's called GALT or MALT, gastric associated lymphatic tissue. And once it gets to the small intestines, we have mucosal associated lymphatic tissue. And again, when you have all these certain types of foods, this is where it gets intestinal inflammation, and this is where leaky gut syndrome occurs. So what happens is, again, the cells get damaged. So the enzymes that are needed to help break down these food particles aren't being utilized appropriately. So this is where you get malabsorption syndrome. So the common cause is gluten, soy, dairy, trans fats, all has to do with certain medications. A lot of NSAIDs will cause this. A lot of antibiotics will not only cause this, but actually the antibiotics, it will clean out your whole intestinal tract. So for females, this is where a lot of times with females who take antibiotics, they get yeast infections because in the vaginal area, they need a certain pH. So when I deal with my patients, first and foremost, what I always look to do is remove the cause. You want to remove the gluten, you want to remove the dairy, you want to remove the refined sugars. Anything that's causing this massive immune response, you have to remove. Next, we need to replace hydrochloric acid, enzymes, and bile salts. Now, the stomach, we secrete hydrochloric acid to help what's called denatured proteins. Protein breakdown starts in the stomach, and we need a certain amount of hydrochloric acid to start that process. When you have leaky gut, because it's an immune response, you actually decrease in the production of hydrochloric acid. So the hydrochloric acid content, the pH in your stomach should roughly be between 1 to 3. And we're not producing enough. This is where it actually goes over to the left, and you're not breaking down these food particles. Also, too, enzymes. Because the tight junctions are being unzipped, the pancreatic enzymes aren't breaking down the food constituents appropriately. So I always add digestive enzymes to help start this process. In addition to very important bile salts. The function of the gallbladder is to store and concentrate bile, which helps break down fats. Fats that we need for fat-soluble vitamins, A, D, E, and K. So again, if you have a leaky gut, what's happening, you're going to have an increased immune response. Your gallbladder is not producing enough bile, and this is where you get malabsorption syndrome. Next, you want to repair. Now, I always repair with L-glutamine. L-glutamine is phenomenal for the mucosal repair, for the smooth muscle repair, again, the submucosal layer and the GI system due to damage from the small intestinal leaky gut. Also, too, herbs like slippery elm, licorice root. Now, again, those two products, I always use them together because it's going to help replace the mucosal lining that's damaged due to leaky gut. Also, you want to remove certain infections that a lot of people overlook. If you have small intestinal bacterial overgrowth, if you have parasites, bacteria, viruses, certain thing in your digestive system, it's going to slow down the repair process, so you must remove all those infections. And then you want to add certain supplements. I always want to add probiotics, 50 billion twice a day. You want to increase your digestive enzymes because, again, with the pancreas secretes the trypsin, the lipase, the pancreatic amylase to help break down the proteins, the fats, and the carbohydrates. Because you're not absorbing them appropriately, you want to add those digestive enzymes with the foods to help with that. Next, always add fiber into the diet. Fiber is phenomenal because, again, it helps with the digestive system. Collagen protein. Collagen protein is very important to use because our body, collagen is the basic building blocks of all our soft tissue. And if you're damaging that soft tissue due to the diet, I always suggest to add collagen protein to help restore that. And collagen is good for, again, the hair, the skin, the nails, to everything. Everything. All the building blocks of our body is based on collagen. Also, too, because the liver plays a big part in how the immune system works, you want to add amino acid called N-acetylcysteine, NAC for short, okay? Because the liver has a phenomenal antioxidant called glutathione. And when you're taking these food products that actually toxify the system, you're decreasing the production of glutathione. So you want to add NAC for liver health. Because again, with leaky gut, you're going to get symptoms like chronic diarrhea, nutritional deficiencies because the enzymes are not doing their job. Poor immune function. Poor immune function is because you broke through the intestinal wall and the undigested food particles, toxins, and bacteria are increasing the immune response. So that leads to headaches and brain fog, okay? Because now you have this huge immune response, so you're increasing norepinephrine and epinephrine, which actually decreases the function of dopamine. Okay, so when you decrease the function of the production of dopamine, this is where you may get the brain fog. And then brain fog comes fatigue because your immune system is on constant overload. Skin rashes, acne, and eczema. Now, vitamins A, D, E, and K, these are fat-soluble vitamins. Vitamin A is phenomenal for skin, as well as eyes. Craving for sugar. Also, arthritis and joint pain, because your body is in this constant fight-or-flight response. Depression and anxiety. Why? Because, again, when you're in this constant fight-or-flight response, the sympathetic nervous system, okay, is burning out the catecholamines, which catecholamines are necessary for the production of dopamine. Also, too, then it's going to lead up to certain autoimmune diseases, rheumatoid arthritis, lupus, Crohn's disease, and of course, celiac disease. So these are just the things that I always recommend with my patients to help heal leaky gut. I hope you enjoyed the video, and I'll see you in the next one. Thank you very much.